According to the Minnesota Department of Health, list prices for many prescription drugs are growing significantly faster than the rate of inflation. Physician and Senator Kelly Morrison is sponsoring a bill that would prohibit excessive price increases for some medicines. She's also the Senate author of the Reproductive Freedom Defense Act, and she joins me now to talk about both measures. Thank you for joining me.
Thank you so much for having me.
As a practicing obstetrician and gynecologist, I would imagine that you have firsthand knowledge of the challenges that face both patients and physicians when it comes to the affordability of needed medicines. Is that right?
That's absolutely true. You know, we see it every day in our practice that patients who struggle to afford the medicines that they need, either to maintain their health and in some cases to survive. You'll recall the story of Alex Smith, who died rationing his insulin as a 26-year-old young man several years ago, which led to, it really heightened everyone's knowledge, I think, about the prescription drug affordability problem that we have in this country. And most of us experience it in our own lives and our own families, but I certainly see it as a physician. It's very frustrating when a patient is trying to manage their health and they can't simply because they cannot afford it.
Your bill then, Senate File 168, would prohibit excessive price increases by manufacturers of generic or off-patent drugs. So is this essentially an anti-price gouging law that is limited to generic drugs?
Well, this bill is a combination of two initiatives. I carried the Prescription Drug Affordability Act when I was in the House the last 4 years, and it's combined now with this anti-price gouging bill. Both were recommendations of the attorney that came out of the Attorney General's bipartisan task force that looked into the prescription drug affordability challenge. So the bill does two things. One, it doesn't prevent price increases, but it does give the Attorney General authority to look into generics and off-patent drugs that exceed certain thresholds when the price increases by 15% over a calendar year or by 40% over the previous 3 calendar years. And the Prescription Drug Affordability Board is a board that looks into drugs that are priced excessively. In other words, they hit certain triggers, and then the board is empowered to investigate those prices to see if they create an affordability challenge for patients or the healthcare system, and then if they do, to set an upper price limit to make those medicines affordable for patients and the system.
So in terms of the generic off-patent drugs, then this board would note that the price increased beyond a certain amount, and then the Attorney General would be empowered to investigate?
Well, that would be the price gouging part of the bill, and that's directed at generics and off-patent drugs because of the complex patent system that has protected a lot of the brand name drugs. So we're unable to go after those drugs. So and this is just aimed at those drugs that really go above and beyond in terms of some of the price increases are kind of eye-popping. And so that they're related but sort of separate but under the same bill. So the Affordability Board can look at all drug prices.
Okay, so the Prescription Drug Affordability Board has been established in 7 other states. There are other states that are considering it.
Yep.
Then there's a Drug Affordability Advisory Council.
That's right.
And so just one more time, kind of explain the difference between these two.
Sure. So the Affordability Board is a 7-member board appointed by the governor with staggered terms. The Advisory Council is a council of advisors to the board. So I've put people from all different parts of the drug supply chain on that board. So we have wholesalers, we have people from pharmaceutical companies, we have manufacturers, we have into health plans, we have patients with lived experience, and we have healthcare economists. So people with expertise in our complicated pharmaceutical supply chain to advise the board when they're making decisions about setting an upper price limit and if that's necessary. So this isn't an automatic thing for all drugs. This is just drugs that exceed certain triggers, and then even then it's not for certain that an upper payment limit will be set, but the board is empowered to decide if it should with the advice of this expert advisory council.
And this is just pointing out how complicated the pricing is in our healthcare system. There is a paid advertisement by pharma that is appearing in some of the daily newsletters that I read, and it blames the price hikes on insurance companies and pharmacy benefit managers. What's your view of the interplay of all these moving parts?
Yeah, well, it's one of the frustrating things about the pharmaceutical supply chain is you'll see a lot of these different players pointing fingers at each other, and it's so complicated that I think there are ways in which they can sometimes get away with raising prices unnecessarily. So I think part of the great thing about the Prescription Drug Affordability Board is this upper price limit pushes it through the supply chain. So it applies to every player along the supply chain. It's not just targeting the manufacturers, although it starts with them because they set that wholesale acquisition cost at the very beginning. So it's a complex system. But really the point is we need to find ways, and the fact that there are now 7 across the country and a growing number of states are considering implementing them as well. This is a crisis, and there's this growing recognition and this growing understanding that we need to get better control of it. Drug prices and pharmaceuticals they're a public good. They're different than other consumer products. If someone needs this medicine to survive or to thrive, that's different than, shopping for a new TV or a new phone or a new product of some kind. This is a public good. This is about our well-being.
Is there any concern, though, that if profits then ultimately become limited by the ability to increase prices by manufacturers, that it could lead to shortages of some drugs that are needed because manufacturers just won't want to gamble with the manufacturing?
I think that's a fair question, and I think that it's important to say, too, that this is not an attack on the pharmaceutical industry. The pharmaceutical industry has created some incredible breakthroughs and continue to, sometimes with help from NIH grants and publicly funded research. I think it's important to note. Ask me the question again. I lost my train of thought.
Oh, the question was about manufacturing and
scarcity.
The profit margin that they require to make these drugs.
Yeah, the pharmaceutical industry is one of the most profitable industries in the world. So there have been a bunch of studies that have shown that if their profits decreased by 11% or 15%, they'd still be the most profitable industry. So there's a lot of room, and you'll note, and you have noticed, that they're spending a lot of money on advertising and lobbying at the Capitol. They recently took out a full-page color ad in the Star Tribune targeting this bill. So we've never seen a pharmaceutical reform that the pharmaceutical industry hasn't attacked or tried to bring down. So we anticipate that. That's sort of a part of this. But there's a lot of room for the pharmaceutical industry to continue to be very profitable, but also be able to create a product that's affordable to people and patients.
Before I let you go, I want to ask you about one other bill that you were a sponsor of. The Reproductive Freedom Defense Act, House File 366, which did pass in the House recently and will likely come before the full Senate. The intent of the bill is to protect reproductive health care providers and out-of-state patients from legal actions in other states where abortion care has been restricted or outlawed. Why is it necessary?
Well, in the wake of the overturning of Roe versus Wade, it's really thrown our country into I hate to overuse the term, but really a public health crisis in terms of maternal morbidity and mortality. We've seen very restrictive reproductive health care laws crop up across the country since that decision came down. And here in Minnesota, we are holding firm that people have the right to access the reproductive health care that they need. So in this new and ever-changing legal landscape, we need to make sure that people who come to Minnesota for refuge and care and the people who take care of them within the borders of Minnesota are protected from laws in other states that specifically target reproductive health care that's legal here in Minnesota. So that's why it's so important that we pass that bill here in Minnesota.
Senator Kelly Morrison, it's a pleasure to have you on the program. Thank you so much.
Thank you so much, Shannon.